Hi, my name is Christa Soleyn, and I am a clinical psychologist with Soleyn Psychological Services. Today, we're going to talk about how to talk with your children about COVID-19. Okay, so now let's look at our 5 tips. The first one is that you have to be ready emotionally for the conversation. Now, children react to what we say and how we say it as well. If you are feeling extra anxious, now isn't the appropriate time to have the conversation. Make sure all is well with you first before you approach your child. The second tip is to provide information that is accurate and honest. Be truthful and age appropriate, and be prepared for lots of questions. This is probably the most difficult part because now we have to decide what exactly will we say. The truth is that children hear a lot more than we think. So be honest. If they ask you, you tell them exactly what COVID is all about, but also make sure to talk to them about the ways to prevent it. So if they ask, can I go by Granny? You'd have to be honest and say, no, you can't, not right now, but you can call Granny at any time. Sometimes children may ask, will I get it? Will something happen to me? And you can be honest as well. The truth is, children hear everything. So a simple answer may be, you have to take precautions to make sure you don't, okay? And then you can talk to them about how you get it as well. Just be prepared to answer all their questions. The second tip is to highlight the positives. And this more has to do with how you say it. So validate the child's feelings. If your child is feeling scared, you can say something like, yes, this seems scary, but now we have a chance to play together. We have a chance to bake a cake together. Focus on the positive when you're answering questions. So if a child says to you, Mommy, will you get it? You will just say, I'm taking precautions. I know you're scared, but it's okay. I'm taking precautions, and now we'll have the chance to just do some activities together. That way you're able to give information, but end it with a positive outlook. The fourth tip, teach children fun ways to reduce the spread of germs. This way, you're teaching your child that they have control. So there are lots of fun videos with children washing their hands while singing a song. Maybe you can implement that as well. So on mornings, have them sing their favorite song while they wash their hands. Also teach them to practice good hygiene, the correct way to cough, not to cough in your bare hands, or if you're using tissue, you throw it away right after and wash your hands, or you cough in your elbow and then you wash it off. You also want to teach them to avoid touching their mouth, eyes, and nose. Now, this is very difficult because children naturally touch. So to tell them stop touching may seem impossible, but all you're doing is trying to teach them the right way. And you can ask them as well, what must you do if you touch something outside? You must go wash your hands. What do you do if you sneeze in a tissue? You must throw it away. Make sure that you are the source for the information that your child has, and make sure you're involved as well. You have to also set the example because, as we know, our children are always watching. And then our fifth step, pay careful attention to what your children see and hear. So a good way to do this is to limit COVID-19 related screen time. We're not hiding our children from it, but just as adults, we have been getting a little anxious about it. Imagine our children. So yes, they may see the news, but after a while, just make sure that you limit it and they go on to something else. Also, show them positive messages related to COVID-19. There are lots of fun challenges coming out, singing a Kaiso song about washing your hands, loads of challenges we're seeing. So if you see one that is age appropriate and one that's fun enough, be sure to show them as well. You may even be able to invite them to make up lyrics to their own song. So you want to have a balance between information sharing and a positive experience as well. So these tips are very short, but they can be very useful. The one thing I want you to take away is to make sure you cushion the information. Just like adults, we may get anxious, we may feel depressed, our children do as well. So make sure that when you're going to talk, you have time to answer their questions and you know how. If you have any questions as well, feel free to shoot me an email, or you can go on my Facebook and Instagram page, Soleyn Psychological Services, and I'll be more than willing to answer your questions. Thank you.